it's a constant challenge because there are definitely a lot of creators out there who have huge followings who aren't necessarily considered the experts, the in within the field. And I think to your point about educating uh, around critical thinking, I think that's the key. I think it's really difficult um, to teach through that nuance um, and part of the challenge, even as a simple concepts, take it like for the pandemic, right? There was a lot of news that we saw changing over time, and naturally that's how science works. It's very dynamic. Sometimes the evidence changes, and our practices change, and but I think to the general public, people were uncomfortable with that idea that, oh, you said this at one point, but why have the recommendations changed? And that's because now we're operating on a different body of evidence, than we did, I don't know, however months or years ago. And it's going to continue to be that way. So we have to continue to reinforce these lessons, and I think there's a way to do it without overwhelming people with the nitty gritty statistics and whatnot. Just to have a healthy dose of skepticism and to encourage people to think twice and confirm their sources and whatnot.
Austin, man, really excited to have you on the show, brother. Being able to just learn about your heart and hustle is like such an opportunity to just share the man, the myth, the legend, the person who sits across from me. So why don't you tell us a little bit about yourself?
Well, I am a gastroenterologist by training, so a doctor. But a couple of years ago, I took the leap and also, uh, took on a corporate role at Medtronic as the chief medical officer for the endoscopy business there. So now I juggle a full-time corporate job as well as a part-time, job as a practicing clinician. So I get to experience both worlds, which is nice. I think they go hand in hand, obviously. And then on top of all of that, I'm pretty active on social media. I've been doing this for over a decade on various platforms, just connecting with people, different audiences on different platforms, and all these different roles and hats that I wear ultimately led to other opportunities like writing a book as well. And yeah, so it's just been quite a journey and career thus far.
One of the things I think is important for us to talk about is, the influence that we can create on social platforms. Like you said, you've been engaging with people on multiple platforms, but people often think that you blow up overnight on one platform, and that's where a lot of your expertise and a lot of your following comes from. Now, from my personal research and what I've heard, right, you also blew up on TikTok, so that's a big part of it. What was the one platform that you think kind of helped you hone your skills to communicate ideas and really start engaging with like a broader audience?
Wow, that's a great question. I would probably have to say TikTok only because it's a video-based platform. And before TikTok, I was on YouTube doing longer form video, but TikTok, it really is about capturing someone's attention and maintaining it for, the very shorter attention span that we all have. And so I had to condense a really complex, thought into a very concise, 15-second soundbite. And so I think that was probably the platform that helped me um, communicate in that way the best. And then other platforms, I think it may have also helped in kind of crafting the captions that I have on Instagram and whatnot to be compelling in certain ways. So, bits and pieces here or there, but at least for video format, TikTok would be the one.
And video format was something that truly like exploded, right, during our lifetime. Because we saw like early YouTube stuff, we saw early Facebook video, we saw Instagram, then they made the switch to go to Reels, right? But that was really in kind of a reaction to the virality of short form video that kind of took over the world in the form of TikTok. Did you kind of think that it was going to be as big as it was when you started creating?
No, I mean, have always been a fan of all forms of social media. So even like when YouTube came out, I was a fan of a lot of YouTubers. I would watch all of their content. And TikTok, I didn't really know like where it was going. And, TikTok had originally come from Musically, which was very focused on like music and dance and all the, fun parts of TikTok and not really used as a platform for education. And granted, my content ended up being like a hybrid of entertainment and education, but I didn't expect it to blow up. And I think part of the reason why it did was because it really coincided with the timing of the pandemic. And so everyone was stuck at home. Everyone was spending a lot more time on their phones, on the internet. So it kind of was the perfect storm that allowed this thing to all just blossom.
Which was the first piece of content, if you even remember, right, where you saw that first piece of virality and you were like, maybe wake up in the morning, check the views, and then all of a sudden you're like, oh my goodness, we're seeing a ton of traction here.
Yeah, I mean, it's funny because I actually went back and reviewed some of my old videos because when TikTok was shut down for that very brief moment, wanted to go back and save whatever I could. And going looking back, there was a moment I remember. It had very little to do with healthcare, but it was some sort of medically themed like trend that I participated on. And yeah, that it was one of those moments where I went to bed, woke up, and suddenly there were, thousands of comments, and it had been shared on other platforms, and it was a
No
little bit
way.
wild. But the one that I felt like actually had some actual impact was there was an educational video early on that I had done about an endoscopic weight loss procedure. And it's one of those procedures that doesn't get much, marketing or publicity. And so not very many people are aware of it. And it kind of went viral. Back then it was, I think, got maybe close to 2 million views, which nowadays I don't think is that much. But then for TikTok, even
Okay,
back
all right,
then, it was
Austin,
like a
relax,
lot.
relax, relax, dude. You know what I mean? That's crazy.
I mean, I don't get millions of views nowadays anymore. It's really rare that I get something like that. But yeah, back then, because it was even a smaller, more focused community, I think it was much more impactful. And people in the comment section were asking, like, where can I get this done? And can you give me more information? And I felt that single-handedly, I was able to refer at least one person to every major academic center that was doing this procedure. And that was one of those moments where I actually felt like, oh, this is actually something that can drive people to, basically access to care. And months later, I had some colleagues actually contact me and tell me that people had actually gotten that procedure done because of that TikTok. So yeah, it was pretty fulfilling to hear that kind of feedback.
What are some of those conversations, right, with a colleague who's like, hey, listen, somebody came through the front doors of the clinic, right, or the surgery center, and it's like, hey, I'm going to get this surgery. I'm interested in learning more. Okay, how did you learn about this? Well, there's this doctor who's on TikTok and he showed me this thing, and like, here's the video. And then they reach out to you. Like, what was that moment of validation really like?
Yeah, it was. I feel like 'cause for so many years, a lot of my colleagues had sort of poo-pooed the idea of social media having any true impact. And granted, there are platforms like X where a lot of folks are chatting. A lot of doctors are chatting amongst themselves and educating one another, and it's a forum for that sort of activity. But to actually reach patients and have that drive where patients are going, that was pretty, new to me. So yeah, it felt really gratifying. And of course, I tried to replicate that like from there on out, but it's been hard. It's not that I feel like early on, it was again because of the pandemic, everyone was not only at home and on their phones, but also more interested in healthcare and interested in learning about it.
Mhm.
Now it's a little bit more difficult because people want to go online and be entertained, and they don't necessarily want to just sit there and learn and be taught to. So it has to be crafted in a certain way to get the message across.
Here's an interesting question for you. And this comes from a podcast I was listening to the other day with an artist named Mike Posner. You ever
Oh
heard of Mike?
yeah, yeah, he's a former Duke alum like me.
Oh, see, there you go. There's the connection. Okay, so Mike Posner hops on a podcast called My First Million. You should check it out if you've never heard of it. And they're talking about the fame and success that he saw, like in a micro period of time. Writes his first song, that thing goes double, triple platinum, right?
Yeah,
Then for the rest of his career, he's trying to write a follow up to a double or a triple platinum record, and it might go platinum, but it wasn't triple platinum.
yeah.
And so my question for you is, as a creator, right? Sometimes we have our moment in time where the audience is right, the tailwinds are behind us, and we get a ton of views, and we often see a lot of validation, but also it's difficult not to kind of tie our self-worth into that. So how have you kind of felt knowing that you had your moment in the sun and maybe you were Icarus where you went a little close, right? And then
Yeah.
you kind of had to settle back down. How has that kind of like mental warfare game kind of been for you?
Oh my gosh, that's such a great question because it is so hard when a lot of my colleagues ask, how do you do this? And they get into it, social media, and to be able to sustain that activity on social media, a lot of it is a mental game, as you describe it, trying to not get caught up in, oh, one day I'm not getting views or I'm not getting people engaging on my content because it's going to ebb and flow on different platforms. For me, I've experienced that where I've had highs and I've had lows and I've come back, and so it really depends. I kind of really had to ground myself in my purpose and what I'm doing here, and doesn't necessarily have to be always educational. In that sense, I sometimes feel like it's just putting myself out there or sharing like my personal experience and using it as a creative outlet. I think as long as I know that I'm doing it for me and that I'm pleased with what I'm putting out there and not forcing content, then I think I'm happy with it. And I've just sort of grown to expect that maybe things bomb and things don't actually, get seen, and that's okay. And fortunately, I've approached social media in a way where I don't tie my income to my social media content, which, there are a lot of people out there who do that, which is great, like good for them. But for me, I think that was one strategy that I had to combat that was that if I had that sort of a link, I feel like I would view social media very differently. So at least it allows me to continue to just be authentic and objective and not worry too much about, another impact on that in addition to like the mental warfare, as you mentioned.
Yeah, I mean, because you do have to establish those really rigid boundaries, right? If I were to look at Austin like as a pie, right? What
Mhm.
percentage of you is the CMO of Medtronic? Percentage of the pie is you as a practicing doc, and which percentage of the pie is kind of your current day perspective of the creator who you are?
Yeah, and that's the thing is like I think people aren't gonna if you continue doing the same thing over and over, it might work for short term, but people are gonna get bored and they want to see you evolve and you have to switch it up. And likewise, as somebody who is constantly putting content out there, I will get bored if I keep on doing the same thing over and over, and I want to be able to not just talk about medicine or medical devices or whatever it is. Like I that's what I want it to be a reflection of who I am in totality, and hopefully the people who are following me recognize that I'm multifaceted and I'm not just, one note.
Yeah, in order to pull that off, though, you have to have such confidence in who you are as a person, right? You have to be grounded in who Austin truly is. Because I mean, one of my favorite creators out there is a guy named Gary Vaynerchuk, goes by
Oh,
Gary
yep,
V. He's in New York, right,
incredible
as well.
marketing guru.
Marketing guru. But what he
Yeah.
talks about, which is interesting, he uses the example, and I'm going to use like a different persona. He's like, guy who's super fit, girl who's super curvy, right? You guys are going to be on social media. You're going to post a certain type of content. And I get a lot of questions as Gary V of like, hey, Gary, I think I'm just kind of like done producing like the shirtless pictures or like me squatting in the gym or like with a bathing suit on. And I want to share the side of me that is more, I like actually drawing and I love painting and I love reading books. But when I post those things, I don't get the engagement. And so it's really tough for me to lean into that part of myself, right? That self awareness is a big challenge for this generation, everybody who's creating.
Yeah, but I've also seen, and that's the thing is I draw on inspiration from other creators too, and I've seen people pivot successfully as well, which is really encouraging. I see people who have blown up on social media have been able to maintain their relevance because they continue switching it up. And again, for me, it's not about maintaining relevance. It's just, I do it because I think it's fun, and if people want to follow along, I hope that it's interesting to them, and I can continue engaging with them, and maybe I can get something out of it by meeting more people. Um, so that's kind of how I see it, is like, it's an extension of who I am, and I don't try to, you know, create like an internet persona and only stick to one thing.
Yeah. Well, I want to talk about, so we've created an audience, right? We talk about your passion for creating and also sharing who you are as a person. But this also had a huge impact on kind of like trajectory of your professional career as well. And if I'm not messing this up, right, you got a kind of a cold call, right? Which was kind of about the opportunity at Medtronic. And if you know anything about Medtronic, this is not a small brand. And so tell people a little bit about kind of that experience of, you maybe not being so interested in looking for the position, but it came to you because of the audience that you built.
Yeah, it was yeah, truly out of the blue. And I think before my being approached for that role, I was, set for this academic path through and through. And again, that was sort of my main focus. So social media was, I always treated it as my side gigs, side project. And so I was very focused on, my core competencies in clinical work. And over time, I think not because I had that focus and I really cared a lot about that, and made sure that I would get the best training possible, and had the network of key opinion leaders within my field. Um, it ended up being that, yeah, my former boss who approached me had been watching my career for a while, saw that I was excelling kind of in the legitimate medical space, and but yet I also had this kind of online identity, was able to communicate on social media, and he kind of wanted that younger energy, and so he approached me with this role of chief medical officer, which, to your point, like Medtronic is a brand, and it's also like a company that's not typically wouldn't typically take this approach, um, because really there aren't that many doctors out there who are academic and like researchers, but also like doing this on the internet, and part of it is because it's such a huge time commitment. But yeah, that's sort of it did lead to me getting this role, and I've been able to parlay it in different ways in that role. Again, a lot of it is communication, both internally within Medtronic and also externally to the general public, and educating the general public on what we're doing at the company, the new technologies that we're coming out with, and not just to the general public, but also to like physicians, and so yeah, it's been super exciting, and I'm hoping to continue to pave the way to be able to leverage this sort of communication, external facing, presence, however I can.
Dude, I mean, like you really kind of like carved out your own role, right, within the organization, and like you were such a unicorn, right, that you were undeniable. That a brand that normally didn't move in this direction was like, we need that. I'm not even sure what that means yet, but we know that that's going to bring value to the brand. Do you think that the humanization, if you will, of the brand was one of the reasons why you've been able to be so successful? Is your ability to communicate and show that there's a person right on the other side of this brand that we all have heard of, seen, and experienced through different surgeries and stuff like that.
Yeah, I think so. I mean, I think that it's still a very much evolving space. Like, I think, I'm not 100% convinced people know what to do with me yet. But I think, healthcare is such a heavily regulated um, space. And I think when you don't have like a clinician, a trained person kind of speaking to this in a way that resonates, it's hard because it can be very nuanced, right? And if you have someone who's able to explain the complexities and talk through the nuance of it, then there's a lot less kind of black and white. And that's the thing, is like medicine and science isn't black or white. Um and so I think maybe in some ways it was very rigid because there wasn't a way to kind of talk through that nuance, and now I'm able to do that a little more effectively. And people are much more informed these days, and they're accessing information and teaching themselves on the internet, and I feel like we need to keep up with the times, and be able to meet people where they are.
I think it's really cool to recognize how, sometimes life happens to people, but sometimes life or people happen to life. And it seems like you're one of those people who is happening to life and really kind of changing industries. Because, I mean, I've spent quite some time on LinkedIn and stuff like that. And why I was so intrigued with your story was I've seen people who work for med device companies and things like that who try and build a brand, right? And unfortunately, they were not received well by their brand. And sometimes it led to termination because it wasn't compliant in the ways in which they communicated. They were sharing too much about themselves. And I'm not going to say this in a negative way, respectful, of course, but the old guard at some of these institutions was like, there's not a place for that here. And so recognizing that you've kind of broke the mold, have you seen other Me Too's or Austins who have come along that other organizations have tried to position in the same way that, you've been so successful?
Oh, first of all, that's a huge compliment to talk about kind of me and life and and that intersection. But I feel I don't know, it's hard to say because I feel like I bring a certain diversity across different platforms that I haven't quite seen. I mean, there are other doctors who are doing what I'm doing. I consider them peers. I talk to them all the time, but none of them are truly embedded in the medical device space the way I am. Um, but I do feel like there will be a day where there's going to be more people like this, and so I really look forward to that day. I think, yeah, it is a very challenging space, and I think from a company standpoint, I get why there's a lot of hesitation and skepticism about like, can we let somebody just talk freely the way I do online? And this wasn't something that was always, I think, comfortable for Medtronic. I think they also had to work with me and learn my what I was about online, and I sort of also know my guardrails a little bit, and know that there are certain things that we need to watch out for that the FDA regulates, and we want to be careful of certain things. And um, the last thing I want to do is to, drive to put a stain on the brand and affect, our investor relationships and whatnot. So I'm very wary of that whenever I'm speaking about something. But at the same time, I do think it's important for us to be there to educate. And I think when I tell myself like what my purpose is on a platform like LinkedIn, it's really, I feel like we've been working within silos for so long. And part of what's slowing down innovation is that we don't completely understand what each other are doing and don't
Mm.
necessarily appreciate what each other are doing. And I can say that being a practicing doctor, that before I joined Medtronic, I had no idea what type of work and how it takes a village to basically bring a new technology to market. And I want to be able to share that with my peers as much as I can, because with that appreciation, I think comes greater adoption and faster innovation as a result. So I think it all kind of mm, it does impact that at the end of the day.
It does. I mean, when I think about you, and I'm saying this with all due respect, of course, right? You are kind of like the knight on the chessboard that is being moved ahead of its time to set up a move in the future. You know what I mean? And when we look back on these times, Austin, when we're, in our 50s and our 60s and our 70s, you're going to have a hell of a story to be able to share, you know what I mean, about the impact that you made on such a gigantic industry. And you were one of those early movers and shakers that had the attention of the people who were, in charge of these spaces to say, hey, we need to kind of get with the times, which healthcare has never really done. And so it just makes you more of that unicorn, you know what I mean?
Well, thank you. Yeah, I'm hoping to. And obviously, this isn't something that I'm doing alone. I feel like there's a lot of other people who are trying to move the space forward. And yeah, and I feel like I have seen a shift over the years where, it was much more discouraged and ridiculed, and, people were scared of it. But at the same time, you see that like everyone is on social media, whichever platform, learning. And I think about even, things like TikTok a couple of years ago when people were like, oh, it's a kids app. People are just dancing on there. Well, the truth is the millions, hundreds of millions of people on that app, if you're going to say they're all teenagers, that's fine. But they're going to be patients and customers and colleagues one day. And, that's why we have to tap into that audience, when we can.
I mean, earlier in our conversation, we were referencing Gary Vee a little bit, right? And one of the sayings that he says when you're being a really good marketer, right? You often influence the person who has influence over the decision maker. So he said, toy companies don't advertise to mom and dad on CNN, but they advertise on Nickelodeon to get a kid excited. So then daughter or son can pull on the shirt of mom and dad at the store and say, hey, I saw that toy. I really want it. It's really interesting to think about how we can strategically position content and media creation as a way to influence the future of healthcare purchases, right? If I'm 40 years old and I grew up watching Austin tell me about education because I'm getting valuetainment, if you will, then the first brand that I'm going to think about is like, hey, when I'm talking to my doc, I'm really going to be looking for a Medtronic tool because that's on the front of my mind, either consciously or subconsciously, right? Once again, playing chess when everybody else seems to be playing checkers.
Yeah, I can see that. I mean, I think that there are, especially for like the consumer facing products that, that we have and but for a medical device company, a lot of the products aren't consumer facing, which is fine. I still feel like social media at the end of the day, like a lot of what I'm trying to do isn't just obviously to drive business, but also just to kind of where I started on social media, educating the general population about their health and the need to get screened for certain cancers and if that does benefit our business, like great, but at the end of the day, like people need to get the care that they're supposed to be getting.
Mhm.
And the preventive care, especially preventive care, if they can get certain things done earlier, it prevents a lot of downstream cost to the overall healthcare system, which, as everyone knows, is very expensive here in the US. So I think these things really matter. It's ultimately like public health.
Yeah. I mean, it's a modernized version of public health. You know what I mean? One of the things that me and my company do is we use like SMS as an engagement strategy for patient engagement. And the biggest thing that we always talk about is like we have to put good, trusted information in front of where people are paying attention. And if somebody's going to be on their phone all day, right, a conversation starter or an update or even a appointment reminder that comes via text that can get you to that preventative care appointment so you can catch something ahead of time, so you can impact your life, so you can drive more cost out of the health sector, but you can also spend more time with your family if you get ahead of a diagnosis. Super important, man. But it all comes back to like the element of humanity. And it's so cool to know that you're like tapped into that as well.
Well, and truthfully, when I first started as when I was a full-time clinician, you know, the thing is I was seeing already 10 plus years ago a lot of misinformation online. So if we weren't present on social media, people can run free saying whatever they want and not be checked by
That
those of
is a
us who
good
actually
point.
have training. Yeah. And so that's what that was, I'm obviously I still see that, rampant on social media, but at least there's a bigger voice now from the trained medical world actually speaking out about, or fact checking some of these things. And there's a lot of headlines out there, right? Like for better or for worse we that we need to talk through a little bit more. Sometimes even the good headlines, there's some nuance to it that people aren't aware of because they're not going to read the actual article. And and so if we can quickly elaborate on that, through a quick video, then that could be super helpful.
I mean, I think one of the concepts that I think is unique to our generation and everybody who's participating in this point in time in history is authority is often
Mm,
confused for popularity, right?
yeah.
Just because you get millions of views doesn't mean that the medical advice that you're giving somebody, right, is the best advice for people to follow. And it
Yeah.
seems like we need to be able to, as a consumer of social media, be able to sharpen that skill, if you will, of critical thinking to be able to do our own research and not take everything at face value just because it has 550,000 shares and 4 million likes or 4 million views on a video. How do you kind of think about that balancing game and where we're at between popularity and accountability
Oh my
or
gosh,
an
it's
authority?
that. Yeah, I mean, it's a constant challenge because there are definitely a lot of creators out there who have huge followings who aren't necessarily considered the experts, the in within the field. And I think to your point about educating uh, around critical thinking, I think that's the key. I think it's really difficult um, to teach through that nuance and part of the challenge, even as a simple concepts, take it like for the pandemic, right? There was a lot of news that we saw changing over time, and naturally that's how science works. It's very dynamic. Sometimes the evidence changes and our practices change. But I think to the general public, people were uncomfortable with that idea that, oh, you said this at one point, but why have the recommendations changed? And that's because now we're operating on a different body of evidence, than we did, I don't know, however months or years ago. And it's going to continue to be that way. So we have to continue to reinforce these lessons, and I think there's a way to do it without overwhelming people with the nitty gritty statistics and whatnot. Just to have a healthy dose of skepticism and to encourage people to think twice and confirm their sources and whatnot.
Yeah, one of my favorite sayings is new data equals new decisions, right? And I really want to
Mm.
hammer this home for anybody who's listening and watching today. If you've ever had a few too many, right, adult beverages, and you wake up the next morning and you're not feeling too good, you might be hungover, people always say, oh, take another drink. That's hair of the dog. If you've ever heard, I learned about this the other day, where that phrase first came from was back in the day, best medical practice was if you were to get bit by a stray dog, you should
Uh-huh.
track that dog down, take some of the hair of that dog, and then stuff it into the wound, and it would stop it from getting infected. That is the hair of the dog. And
Whoa,
so
that's where it comes from. Okay, I
that's
didn't
where it comes
know
from. I
that.
mean, it's just, I mean, think about the logic, right? If we were to always say new data or not believe in new data equals new decisions, people would still be trying to, if you got bit by a dog, track that dog down, grab some hair, stuff it into the wound because I don't want to get an infection. It's like we need to think about spaces, even like healthcare, as being consistently progressive, right? It's super,
Yeah,
super important.
yeah, and I think it's such a complex space. Like, how do we get this message across in a way that's appealing and factual? And I think historically we've just done a really bad job in medicine educating our communities. And I feel like there's always been this idea of like we have to wear the white coat all the time and be, look like an authority. And I think like in this day and age, people don't relate to that. Like if you're gonna relay a certain message, you have to be relatable and you have to meet people where they are once again and speak to them not from necessarily like an authority perspective, but a friend, a colleague, someone who's going through the same thing and having the same questions. And so that's what the way I've tried to approach my content is like, look, I have some of the same doubts. I have some of the same questions that you do, but this is the reason why I've come to my conclusion and why maybe you can trust what I'm saying.
So here earlier in our conversation, you talked a little bit about for those few days, right, when TikTok disappeared, right?
Mhm.
What do you think, if you don't mind me asking your opinion, because you have such a big audience on some of those platforms, what happens if that space disappears, right? How are you going to handle TikTok being banned if it's not sold to an American entity and all the other kind of buzzwords and statements that we're hearing out there? What's your opinion?
Well, I think luckily for me, just like a financial portfolio, I've diversified my presence and I'm present on
A
other platforms. So it didn't concern me too much. And I think the natural progression of social media platforms over time is that people are going to gravitate towards other platforms anyway, right? Like the platforms that we loved 10 years ago are not necessarily the same platforms that we use all the time today, right? Like take Facebook or, uh, some of them have come and gone. MySpace, Friendster, things that don't even exist anymore.
Friendster, so true. Yeah.
Yeah. And so I feel like having seen the rise and fall of a lot of these platforms, like TikTok's not going to necessarily last forever either. And we saw it even in that brief moment of like 24 hours or however long it was, there was a massive migration to Red Note, and so people will find a different place to establish themselves. Um, and the reason why I think I wasn't so concerned was the scare of TikTok being banned. This wasn't even the first time. Like this was the first time that I think that we actually saw a shutdown, but this scare had happened many times before in the past. And so there were moments where people were migrating to all sorts of platforms that I don't even know if people are still using today, like Mastodon. And
Mm,
you may have
yeah.
remembered those days a couple of years ago. And yeah, I've gravitated towards some platforms and loved it for a moment and then like gone on to others. And the thing is nowadays there are just too many platforms, right? And each one will have its dedicated audience. And as big as TikTok is, that's not where everyone is. So just because you're not on that platform or you don't like to communicate there doesn't mean you can't communicate elsewhere. I feel like if I wanted to, I could maybe try out Twitch and stream on Twitch, or I could be more active on Blue Sky. But there are only so many hours in a day, and I have to pick what what I, devote my time to. So I've kind of chosen which ones I use the most.
I would love to see Austin on Twitch, right? Live streaming, playing Fortnite, just putting people down and then giving like a clinical diagnosis of the injury that might have, done him down.
I've
That would be
thought
really
about
fun.
it, but I think just the nature of Twitch being a live streaming platform, it just doesn't, I just can't because I've got a day job and there's like
Yeah.
I can't be on there for hours on end. But kudos to
So
the people who are doing that full time because it's not an easy job.
dude, not an easy job at all, but these guys are putting in like hundreds and hundreds of hours of time behind the camera. One of the scariest things, and this is going to be interesting, there was a trend that was happening where they were there was a trend with a whole bunch of streamers who wear headphones all the time,
Uh,
right? And they were actually looking at like, and you can tell me if this is real or not, but this is this thing that I saw. People who are wearing headphones for 8 hours a day, 10 hours a day, streaming 7 days a week, they were finding that some of these guys were having like dents in their skull
really?
because of the consistent pressure of their headphones. And so they take them off and then look at their head when it was shaved and they would have a little indentation. It's very similar to if you've seen kind of like what the future human's going to look like because
Uh-huh.
we sit at desks all day and everybody's on their devices and stuff like that. You get like an elongated neck and like your fingers don't look proportional and like those type of things. And like you have an
Yeah.
extended pinky divot because you're holding your phone all the time. What's kind of your opinion on like what the future of a human could look like if you've ever seen one of those memes?
I mean, it's totally possible. And the dent, I definitely believe. I mean, it's
Okay.
just like
Oh
I
my
wear
goodness.
glasses and like I feel like there's a dent that's been created in the side of my head. So I totally buy. I don't know about the elongated neck thing, because I don't know if that's really a favored trait
I
that will
agree.
like, that will actually be something that gets passed down. But we'll see how we adapt to what all the technology that we have to interface with these days, and I feel like it's only going to be more, right? Like there's if you think about where we are today, I think about just the fact that we have a computer in our hands with a phone, and so many things like grocery shopping or like getting transportation, like things like this that at one point weren't imaginable to be just done at your fingertips are just so much easier.
I hosted this guy on another podcast that I host with one of my buddies called the All Innovation Podcast. And we were talking to this guy, CEO, 10-time Inc. 5000 CEO, owns a company called AccuCode. And he was telling us about where technology is today that people have a misconception, right? There's a
Mm.
company in Denver, Colorado called Iterate AI that has found out how to basically turn an AI agent, if you will, into a small enough data set that it can be uploaded and run on a processor from any type of device, including security cameras, from 2010 forward. So we don't need
Oh,
NVIDIA chips, but rather they can turn any security camera in a Walmart or anything else like that, or an airport, right?
uh,
That can then start doing things like, okay, I see Austin walking in to the airport as an example with his bag. Now, the video camera, security camera system is good enough to see when Austin puts his bag on the scale, it weighs 49.9 pounds because you came in just below the little weight limit. What I can now do is use the infrastructure of these cameras to track the bag throughout the entire distribution center, all the way until it gets to the plane. So no
wow.
longer in the future is there going to be a world where Austin checks a bag and then it doesn't make it there. The plane will be delayed until the system can catch up and get Austin's bag there. So we're
Wow.
talking about the adoption of new technology like AI being able to be layered over old technology. Another crazy example, a town in Europe for the last 6 months or something like that has been doing pay by license plate at a
Oh, yeah.
specific store brand. Have you heard of this?
No, 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 but I feel like I feel like I've heard of something similar. Yeah.
So what they do is they put AI on all the security cameras once again. As you walk through the store, facial recognition, I can tell that it's Austin. I can look at and validate the plate that he got out of from his car in the parking lot.
Oh, yeah. Well,
There's a
this
payment
happens,
method.
yeah, in Asia, like my parents live in Taiwan, and when you go into parking structures, you just drive in, drive out.
Yeah. And I'm
Yeah,
like, dude, like to think about this stuff, this seems like an ultra futuristic world, but like that stuff is here right now. And
yeah,
so to kind
absolutely.
of rally on that conversation, what are you most excited about from like the world of innovation and everything else that's changing in our lifetime right now, brother?
Well, I mean, I'm biased because I work in healthcare, and some of the things that you're describing are happening right now in healthcare. And that's actually part of what drew me to this role at Medtronic was because we are at the forefront of AI in healthcare in some ways. And within my field of gastroenterology, we have AI applied to colonoscopy. So to your point, like an old procedure, an established procedure with now an AI kind of overlay on it, and it literally helps doctors be able to not miss certain polyps and which are like precancerous growth and the evidence has all basically shown that it can improve detection, so that's pretty impactful. And I think in the future, right, like I can envision this world, and there are a lot of different elements within healthcare that AI can be applied to, but a world where you're taking all of the data and insights from lab tests, from imaging, from procedures, and the patient's own medical history and their experiences, through multiple hospital stays, and be able to aggregate that and predict maybe what the next best step should be, and that can help ensure that they get the best care possible. So, obviously, like to actually execute on that is going to be, I'm sure, a long road ahead, but, I think it's possible. It's just going to take a lot of coordination.
Yeah, we I hosted a guy on the podcast once again, the All Innovation podcast. This guy named Philippe Kahn, and
Mm.
Philippe Kahn is interesting because he was actually credited with actually building the first all-in-one camera phone solution.
Oh,
And
wow.
in 1997, he sent the first publicly shared picture of his daughter after she was born on a public network, right? And now he owns a company called, I want to say it's Full Power AI, that's strategically actually worked and partnered with Tempur-Pedic. And so he's like, we've got about 10 million, I might be messing up the number, but sleep sessions over the last like year that we're tracking. And one of the things that we talked about, which is interesting, is if you have compiled all of that data, right? He said one thing that's interesting is people who have been being tracked in our system have had strokes, they've had heart attacks, they've passed away in their sleep. And so what we're looking to do is go back to retroactively look at all the data and see if we can find trends in their HRV, in their sleep patterns, in their breath rate, in their heart rate while they're sleeping. So we can then compile all that data and then combine it, like you said, with EHR data and everything else that comes from labs to be able to be a little bit more predictive in the future. And I was like,
So cool. So
my
like
brain.
they're envisioning like a dynamic mattress or something that can get you the best kind of sleep
I mean,
or
so
something like
there,
that.
that's already out there. I have a
Oh,
system
wow.
called 8 Sleep, which is
Okay.
a mattress pod. So it's basically like a mattress sheet that you put over, right?
Okay.
It's got a whole bunch of sensors in it. It heats and cools, and there's an AI component called autopilot that adjusts at nighttime, temperature wise, to keep you in REM
Wow.
sleep and help you sleep deeper. So that data is constantly being fed to my phone every single day. Like last night, you got an 85. Your HRV was 117. Your sleeping breath rate was, 14 point blah, blah, blah. It's really interesting to see all the data that's just kind of flowing out of us as humans. But
Yeah.
in the future is going to be utilized to help us from like a humanistic health perspective.
Yeah, that's incredible. I mean, yeah, I think down to the individual person or patient, but also, there's AI being developed to help, optimize how we do procedures, to guide how we do things. And, with if you combine that with like robotics, for instance, like the precision that you can achieve, I think is going to also be super cool. Yeah, so I mean, I'm just really excited about, the direction things are going. I feel like technology, it's finally, because of how computing power has evolved, it's finally at a point where we can apply AI and machine learning to a lot of these applications. So I'm excited.
Well, brother, it's been such a blast having you on the podcast. And it's so cool to be able to look back at this conversation that we've had in like 10 years and think about how much has changed, man. And I hope that,
Yeah.
we can stay connected. And I hope I can have you back on the show. But
Oh,
it's been an absolute blast
absolutely.
having you, man.
Thank you. No, it's so much fun chatting with you, and I'm so excited about, to your point, like where things are going to be 10 years from now. Because if you think back 10 years from where we are now, right? Like it was a very different world, and I can only imagine, where we're going to go in the next 10.
Well, I'm excited that you're a leader of the future and you're going to help usher us into that new chapter, man.
Oh,
So,
I hope so. That's my sincere hope.
well, there we go, guys. That's the podcast. We'll catch you in the next one.
Thank you.